Hello, everyone. Okay, so basically, the case that I'm presenting is I need help getting the residents of the Public Housing Authority to trust me. They're older, and I'm looking basically for suggestions on how to build the trust to help them get interested in quitting. As we go along here, I stated in the last presentation where we presented Miss Emma was there on property, and she's actually in the chat room today, which I'm glad to see she's on. She was a great help in collaborating with this. But when she was on property, everyone that she spoke to said that they had already quit or that they had no family member or anyone with them that they knew still smoked. But then they were either observed going to the smoking area or we knew they came from the smoking area. So basically, they're just scared, you know, that if they say, yes, we're smokers and we need this help, that they might lose their housing. I'm looking for ideas on how to better interact with the residents to get them to work with us to help them. And currently, there's actually no process. I'm working to set up relationships with people who can help me. I've met with several people. I met with the Winter Haven Housing Authority. I presented a tentative calendar with events of when I would be on the property. I prepared an MOU. I set up meetings with Ms. Julie Davis, which is the tobacco manager for the health department here in Polk County. Created a 5W flyer, set up meetings with Ms. Denise Benavides. I've received good feedback from the Winter Haven Housing Authority. The meetings have been all successful, and they agreed to the events I tentatively planned, but we are still waiting and in the process of that MOU being signed so that I can go on property. The vision of what it will look like, basically it would be a fully bridged gap between the Winter Haven Housing Authority and Central Florida Healthcare, and that the residents feel comfortable saying, hey, I need help, without being scared to approach and or get help from us for fear of losing their housing. So that's the help that I need.
Okay, that's great. Thank you so much. Turning it over to all of our faculty and everybody else on the phone, do you have any clarifying questions that you wanted to ask?
Hi, this is Bob Burns at the National Center for Health and Public Housing. And Jessica, it sounds like you're going about this in just the right way. I'm just curious how closely you're working with the resident council or resident advisory board, and especially since most of those folks are usually a little bit senior and have a good amount of influence with the rest of the residents.
At this moment, I'm currently just waiting on the MOU. Once I have the MOU, the Memorandum of Understanding signed, I can get closer to those residents and I can be on property without, you know, having to go ask for permission or this and that. I think the MOU, getting that back is the first step to be able to bridge that part of it, but I have not spoken to that particular person as of yet.
And have you engaged in any kind of, you know, aggressive, I guess, communications effort yet, just to get the word out that that providing the information to you about their smoking habits does not, you know, cause a problem for them in terms of maintaining their housing?
I have not, but that's a great idea, and I'm going to write that down.
And I'll send all this to you in notes, Jessica, so if you don't capture it right now, that's okay. I'll send it to you.
Okay.
Great. All right. Anybody else have any questions or suggestions? Thanks, Bob. That was great.
So this is Barbara Turner. I want to add in here, part of our challenge with the Housing Authority has been there's been a change in personnel. And so some of the relationships that we've recently built, we're having to rebuild. And so that's been part of our challenge too. So, so I just want to throw that in there too. So we're rebuilding some of our relationships, and I know that Emma has been out there and she did build some relationships. So this is a whole new chapter of trying to redo that again.
Thank you.
Yeah, this is Frank. I guess I really embrace the direct approach, and I would just say, whether you're talking to someone individually or in a group, that I know many of you are scared, or you in particular may be scared that letting us know you're a smoker may mean that you'll lose your housing, but that is not the case. So I think you just need to address that fear right up front and let them know that that isn't going to happen. And I would probably have some kind of function, party, whatever you want to call it, where you could get to know these people individually, and have them tell you their story. Maybe you can tell, give your background and what you're there to do, but in a positive way in terms of helping them improve their health. So something around that idea as a kind of group function might help.
Thank you.
Absolutely.
Hi, this is Amy.
Oh, no, go ahead, Amy.
Yeah, add on to what Frank said too. If you can get a group together of all the residents, or just have that invite extended to all the residents, and just making your face known, getting your face out there. So I saw some of your calendar of events, and I think that's great. You'll have a chance to try to connect with them, but just maybe initially just sending an invitation to meet with all of them. And maybe less so, making it very clear that you're not there to try to scare them off or punish them or take away their housing. Just making it clear that you're focused on and care about their health, you're invested in their health. You're just there to help support them wherever they may be with thinking about quitting or during their quitting journey, that you can provide some, really evidence-based helpful resources or treatment to them. But I think just getting your face out there and maybe less so focusing right off the bat on their tobacco use, and just trying to get to know them on a more personal level, share things about yourself, so they don't think that you are only there to kind of hound them about tobacco, that you're just there kind of as a support person, and you're just really invested in their health in general.
Yeah, this is Steve. Just to add on to that, I wouldn't underestimate the power of stories. So if you could share stories about people that you know who smoked and how hard it's been, and some of them were able to quit and others weren't, to sort of humanize your approach and make yourself a little less threatening, as Amy hinted.
This is awesome. Thank you.
Yeah, and this is Bob Burns again. This time of year is a great time with the fall coming to pull folks together. And a lot of the housing agencies and health centers around right now are kind of, doing events, barbecues and that kind of thing, and kind of using it as an opportunity to address health and wellness. And this could certainly be part of that. We were working with some folks in Chicago recently, and they kind of pulled together their fitness person and their horticulturalist who kind of runs their garden, along with the medical staff and the counseling staff, and they're addressing in particular smoking cessation, diabetes, and as Steve mentioned, trying to promote and actually having a little award ceremony relative to some folks who have been successful with the cessation part, and some other folks who've been successful with exercise and diet and getting their diabetes under control. So it's just a thought.
Thank you. That's great. And then from the chat, Sean McCormick said, have you had a resident meeting to let folks ask questions in an open forum, which I know you're working on, especially about how the lease has a name to evict. Another idea is to bring sample packs of nicotine gum, lozenges, patches, let people try them, let them know NRT products are covered by all insurance plans. In many states, even mail NRT and Chantix through 1-800-QUIT-NOW. And then he had another idea about providing a private channel to ask questions about everything. Make everybody feel a little safer. It's a very good idea. And then Catherine Messi LC said, CDC TIPS will be offering another round of free NRT. I'll see what the dates are so we can share with all of you to help promote wellness and healthy options. So that's great. I guess going to them with free resources to help them so they don't have to look too hard or too far. That's wonderful. Jessica, any other questions come to mind from this feedback?
No, this is all great information. I appreciate everyone's input. Thank you so very much for helping me out with this, and I will let you guys know how it goes.
Okay, great.
Becky, this is Maria with NAC. I do have just one quick follow-up on the TIPS campaign. So yes, the TIPS campaign will be, they'll have a round of promotion that will identify free NRT resources, but it's if it's available at the state quit line. So I think it would be helpful maybe if we connected and just let everybody, all the partners know for the state quit lines that are participating in this project, what their capacity is and what kind of support they'll be providing as far as NRT around this next promotion, because not all 53 state quit lines are able to do that for all the promotions. They try very hard to do that, but it does fluctuate. So rather than making a direct connect and saying you can for sure get it through your state quit line, and CDC really uses the terminology, if available through your state quit line and something to that effect. So we can gather that information and share it, and I'll work with Tasha to make sure that for the state quit lines participating in this, we have a really good handle on what level of free NRT they're going to be providing throughout the TIPS campaign. So nobody has any, set expectations that can't be met. I would hate for that to happen.
Me too, and thank you for that. Once you get back to me, I'll make sure everybody gets the information. All right, anybody have any other thoughts or anything else that you think would be helpful for Jessica to consider as she begins her outreach to the Housing Authority residents? I had a question. What about working, I know that you're just starting real work with Winter Haven Housing Authority, and you're getting the MOU signed and you're really moving forward, but do you know what they've told their residents? Do you have any idea, where people are hearing that? If it's something that they've heard from them, or if it's something that they're just concerned about separately, and having them, having the Housing Authority staff clarify with their residents, kind of leading up to your work with them?
I have not heard that sense, but when I did sit down to meet with them, they are saying that there are various of their residents that still are addicted and still are smoking. They do see them either smoking out of their homes, but they do know and are aware that some are still smoking in the homes. So they are aware, and they do know that this is very important, what we're trying to do here. So they do want that help. It's just getting the actual residents on board.
Sure. So just to clarify, the Housing Authority has let the residents know that you will be working with them?
Yes, they're in the process of that, yes.
Okay, that's great. And then, to Bridget's point earlier, do you know if they've set aside areas for smoking on their campus?
They do. They have several smoking areas, and when I was on property, I was able to see a couple of them, so yes.
Okay, that's great. Something that we've talked about in the past on these echoes is, when people are at the smoking areas, approaching them with a blue card that, I will be getting to you, but the 1-800-QUIT-NOW card. But just, either creating a nice display for them to be able to take it, or might be an opportunity to go up to them individually in a non-threatening manner and just say, hey, I can help you. I have a resource for you. So you should get those in the mail probably early next week.
Thank you so much.